Welcome to the 2026 TPA Board of Directors Candidate Forum. The Texas Pharmacy Association Nominating Committee, chaired by immediate past President Joby John, selected this slate of candidates from the many nominees put forth by the membership. This presentation is designed to help you learn about the candidates and what they hope to accomplish if elected to the TPA board, as well as their vision for the future of pharmacy in Texas. TPA members eligible to vote will receive their ballot via email on Monday, July 27th, with the ballot staying open through Monday, August 10th. Now to meet our candidate for president-elect, Chris Alvarado.
I am Chris Alvarado, a dedicated board member with the Texas Pharmacy Association, staff pharmacist at HEB in San Antonio, and advanced community API coordinator for the University of Texas College of Pharmacy, San Antonio campus. As a proud inaugural graduate of the UIW Fike School of Pharmacy, class of 2010, I am eager to continue serving on the TPA board, driven by my passion for pharmacy and its stakeholders, including pharmacists, technicians, and students. With 23 years of experience as a pharmacy technician and 16 years as a pharmacist in retail and independent settings, I possess a deep understanding of the profession. My expertise extends to both pharmacy compounding, both sterile and non-sterile, hazardous and non-hazardous. I have 17 years of board experience with TPA PharmPack, including leadership roles as chair and vice chair. I have also had the privilege of serving on John Garza's District 117 Health Services Committee, advocating for pharmacy interests at the Texas Capitol and the U.S. Capitol. Additionally, I have advocated before the Texas State Board of Pharmacy and raised funds for the TPA PharmPack, TPA Foundation, and the Chris and Stephanie Advocacy Endowed Scholarship at UIW. My service extends to various pharmacy organizations, including president of the Bexar County Pharmacy Association, West Texas Pharmacy Association, and the UIW Fike School of Pharmacy Alumni Network. I have received numerous awards, including the prestigious Bowl of Hygiene Award in 2017. Having served twice on the TPA Board of Directors, I am well equipped to continue advocating for our profession and expanding our reach. My focus is on growing membership, recruiting pharmacy students, and promoting advocacy in our universities, where I have spoken on numerous occasions. I kindly request your consideration to slate me for the Board of Directors, with the vision to build a strong community and expand our presence in the lives of patients across Texas, ensuring we make a positive impact every day. Thank you for the opportunity to continue to care for Texans.
For Vice President, Lauren Sokol-Corrales.
Hi, I'm Lauren Corrales. I am currently Vice President on the TPA board. I'm a long-term care pharmacist at Carvajal Pharmacy in San Antonio, and I've been here since 2012. I'm currently pharmacist manager of the long-term care at home department, focusing on transitions of care. I'm also on the board of directors for Bexar County Pharmacy Association and on the TPA PharmPack board. I've had the honor of serving as vice president. I was also treasurer for TPA. I'm just really passionate about advocating legislature that empowers pharmacists to practice at the top of their license and improve patient care across Texas. And just as importantly, I want to continue to advocate for fair reimbursement and transparency in pharmacy so that pharmacies can stop closing their doors and continue serving their communities. My vision for pharmacy is one where pharmacists can be recognized as essential healthcare providers, where our role in preventative care, chronic disease state management, and transitions of care is not just acknowledged but supported through meaningful policy change. Beyond pharmacy, I'm a mom of 3. I am president of the kids PTA at school. I thrive under pressure, and I just really enjoy being involved in the community. I'm very passionate about pharmacy and would really appreciate your consideration to continue to serve on the board. Thank you.
For Vice President, Casey Nicholas.
Hello, my name is Casey Nicholas, and I'm a district pharmacy supervisor with Walgreens in San Antonio, Texas. I have spent over 10 years as a pharmacist in the community practice setting, and am currently supporting and overseeing operations, clinical performance, and compliance at multiple pharmacy locations here in the San Antonio area. My background has given me a broad view of the operational and clinical and advocacy challenges that are is facing pharmacy in Texas today. I have been a part of TPA since I moved to Texas, starting as a member, then joining councils, and currently I'm serving as your treasurer on the board of directors. I want to continue to serve on the TPA board of directors to help advocate for the profession, ensure pharmacists have a strong, unified voice at the state level. As pharmacy practice continues to evolve, I believe it's critical that our policies reflect the realities of frontline practice while supporting sustainable business models and expanded patient care services. If elected, I hope to contribute practical insight from community practice, support initiatives that strengthen pharmacist reimbursement and provider status, and help mentor future pharmacy leaders through the work that Texas Pharmacy Association does. My vision for pharmacy in Texas is seeing us be able to operate at the top of our education and experience, not just at the top of our licenses. I believe Texas pharmacy should continue to expand clinical services, leverage technology, and strengthen collaboration with other healthcare professionals. With strong advocacy, leadership development, and innovation, pharmacy can remain the most accessible, trusted, and indispensable part of our healthcare communities. Thank you.
For Treasurer-elect, Clarence Richardson.
Hi, my name is Clarence Richardson. I'm a pharmacy manager at HEB Pharmacy in Hudson Oaks, Texas. I've been a pharmacist for 12 years. 10 of those years I've been a pharmacy manager. I've been in pharmacy for 18 years, and I'm looking to continue to be involved in TPA by running for treasurer-elect this year. I've been on the board for the past 2 years as speaker-elect and also as Speaker of the House, so I have had plenty of experience on how to navigate different issues on the board, and as well as working together to formulate different strategies and plans to help advance our profession. My goal is to be able to continue to encourage pharmacists to join TPA, as well as make sure that we are financially and structurally sound as an organization so that we can continue to go after our different initiatives that we may be looking forward to, especially coming up in this legislative session next year. And so I would really look forward to having your support as I continue to run for the board position this year. And looking forward to meeting a lot of you and hearing different ideas and ways that we can get you involved so that we can be able to have a louder voice this coming year and be able to continue the momentum we've gained the past couple of years against our PBMs, and also trying to become and get more support in the community healthcare worker area as we enter this new era of pharmacy. Again, thank you for any support that you're able to offer, and I'm looking forward to meeting you at the TPA conference this year in the summer.
For Treasurer-elect, Caroline No.
Hello, my name is Caroline No. I am a pharmacy manager at Walmart Pharmacy in Galveston, Texas. I've been with this company for the last 4 years. Previously, I was employed with Walgreens, almost 25 years, starting from a technician, moving on to pharmacy school, internship, and I decided to stay on as a retail community pharmacist. As a retail community pharmacist, there have been different things that we do to help our patients. My goal as a pharmacist when I'm working is to educate my patient, have them stay connected, and most importantly, to make sure that they understand the value of their medication and why to stay adherent. In terms of Texas Pharmacy Association, I know there are a lot of legislation that we have been working on for years and decades that we continue to work on. But one of the things that I'd like to be able to see us do is to get that provider status to do preventative type of medications and screenings. You know, if we could get that strep throat testing done, if we could get antibiotics done, if we could get birth control done, and get that approved in the state of Texas, that would be a step forward for the future of pharmacy. I have been a member with Texas Pharmacy Association because I see the value of it. I enjoy being part of it. I go every year to the conferences, and a lot of times when I'm going, I don't go knowing that I have other people to go with. I go because I want to and encourage others to go, and I tell them the benefits of going, the location, what CEs we have. Other part of wanting me to promote to other people that don't know the value of TPA is just the benefits. Like, we all are required to do a CE, and that's something as a member we get provided with every so often with included CEs. I have been the past president of VAPA, the Vietnamese American Pharmacy Association, and during the time, and I'm still an active member, what I see is we have 300 members plus, but what I do see is that a lot of people join because they have that connection. The networking should be there, the friendships should be developed, and that's what I would like to see TPA continue with. I am mainly focused in the Houston area. I know there is opportunity and I know there's an outreach for it. And I know that people know what TPA is, but perhaps they fell off, joined in the school, and for whatever choices that were made, they didn't continue their membership. I know there is an opportunity for us for membership outreach, and I'd like to be a part of that. I'd like to see any future enhancements that pharmacy can do and have our hands in. I'd like to support that, and I think TPA provides that support group for us, and I'd like to be a part of that. Thank you.
For Director, Position 1, Benjamin McNabb.
The future of Texas pharmacy is bright, but only if we maintain a strong Texas Pharmacy Association to advocate for our profession, speak with a clear, unified voice, foster collaboration across every practice setting, and prepare the next generation of pharmacy leaders for the opportunities ahead. I'm Ben McNabb. I own Love Oak Pharmacy in Eastland, Texas, and through my work with TPA, NCPA, and CPS in Texas, I've had the privilege to work alongside pharmacists across the state who are passionate about PBM reform, advancing our profession, and improving patient care. If elected to the TPA Board of Directors, I'll continue to listen, build relationships, and bring people together to tackle the challenges ahead and create new opportunities for our profession. No matter where you practice, we're stronger when we work together. Thank you for everything you do for your patients, your communities, and our profession. I would be honored to earn your support.
For Director, Position 2, Judy Ross.
Hi, my name is Judy Ross, and I have been a proud registered pharmacist in Texas for over 30 years, and it is my honor to be running for the Board of Directors for the Texas Pharmacy Association. Over the past 30 years, I have witnessed the profession of pharmacy evolve into one of the most accessible and trusted points of patient care in our healthcare system. Every day, pharmacists across Texas serve on the front lines, educating patients, improving outcomes, and ensuring access to critical therapies. With that responsibility comes a profound obligation to advocate for the millions of Texans who depend on us each year. To continue meeting that responsibility, pharmacists must have the ability to practice fully and effectively. That means protecting access to pharmacy services, strengthening reimbursement models that sustain community pharmacies, and ensuring pharmacists can practice at the top of their education, training, and experience. When we stand together and raise our collective voices, we have the power to shape the future of healthcare and advance the profession of pharmacy in Texas. Over the past 2 years, I have seen firsthand the impact that strong advocacy through TPA can achieve. TPA's legislative leadership has elevated the voice of pharmacists and brought our profession to the forefront of meaningful healthcare discussions in Texas. Because of these efforts, we have made important progress, but there is still much work to be done. In my current role within a rare disease pharmacy, I see every day how vital it is to improve patient access and secure equitable reimbursement for life-changing therapies. These patients and families depend on us not only for medication, but for hope, guidance, and support. I am proud of TPA's commitment to these issues and its partnership in advancing solutions that truly make a difference for patients and providers alike. Serving on the TPA Board of Directors would be an opportunity for me to give back to the profession that has given so much to me. With experience spanning managed care, community pharmacy, specialty pharmacy, and industry, I believe I can bring a balanced and practical perspective to help guide the future of pharmacy in Texas. It would be a tremendous honor to serve you and advocate alongside you for the continued advancement of our profession and the patients we proudly serve. Thank you so much for your support.
For Director, Position 2, Tram Nguyen.
Hi everyone, my name is Tram Nguyen, and I'm currently running for one of the TPA Board of Directors position. I currently work for Walgreens as a pharmacy supervisor, where I help to lead and support our pharmacists and our pharmacy teams. I've spent over 20 years in pharmacy, and I see the things we deal with every single day, the challenges, the pressure, but I also see the impacts that we make as pharmacists. We need to advocate for our profession, not just for us, but for the communities that we serve, making sure that we are recognized as essential healthcare providers we already are. I'm running for the TPA Board of Directors, not just to have a seat, but to be a voice, one who shows up and stands up. If you're looking for someone who will listen, stand with you, and fight for our profession, I'd be honored to have your vote. I'd appreciate the opportunity to represent you. Let's make our voices stronger together.
For Technician Director, Kendra Courthauer.
Hi, I'm Kendra Courthauer, Pharmacy Manager at Norman's Pharmacy and a member of TPA for 26 years. I currently serve on the board for Pharmacists United for Truth and Transparency, advocating for pharmacy, as well as with the Texas Legislative Advisory Panel for American Pharmacies, where we help advance pro-pharmacy policy at the state level. You are all aware we operate in an environment of escalating regulatory and economic pressure. Across Texas, pharmacies have absorbed underwater PBM reimbursements that no business can withstand. We continue to fight against retroactive fees, clawbacks, and punitive audits that destabilize revenue we believe was settled. Add in PBM steering and opaque pricing, and operation strain on community pharmacies has become critical. This is today's reality. Our work means we need to be on the front lines of this fight. We must advocate for pro-patient, pro-pharmacy legislation and confront predatory PBM practices. On your board, I will bring my experience directly to TPA's legislative advocacy, pressing for transparency, fair reimbursement models, increased pharmacist scope of practice, smart integration of AI, and more accountability for the entities driving us underwater. I will help bridge aggressive regulatory strategy with disciplined, coordinated advocacy. This is about more than margins. It's about protecting patient choice and preserving healthcare access in every Texas community we serve. We are stronger unified, and the work ahead demands experienced, battle-tested leadership. I am ready to deliver it. I respectfully ask for your vote for the TPA Board of Directors. Thank you.
For Technician Director, John Hickman.
Association members, I'm John Dyer Hickman. I'm a pharmacy technician and owner of Dyer Drugstore in Farmersville, Texas. We're a family-owned independent pharmacy that has served our community for over 95 years. I've had the opportunity to experience pharmacy through multiple roles over the years. I've worked directly in the day-to-day realities of pharmacy while also understanding the operational and financial responsibilities required to keep a community pharmacy strong and sustainable for employees, patients, and the communities we serve. Financial pressures facing pharmacies don't just affect owners. They affect the entire team. Technicians are essential to keeping pharmacies running every day. And the pharmacies want to keep good people and pay them what they're worth. But when reimbursement keeps shrinking and pressures keep increasing, those challenges eventually impact staffing, retention, and the long-term sustainability of pharmacy itself. Now, pharmacy is under tremendous pressure. We're dealing with low reimbursement, increasing administrative burden, workforce challenges, and continued pressure from PBMs, impacting the ability of pharmacies to survive and continue serving patients. I believe stronger engagement and advocacy involvement are important to the future of pharmacy. Many people care deeply about the profession, but are unsure how to get involved or where to begin. Encouraging participation and building relationships will be important if pharmacy is going to have a stronger voice moving forward. If elected to serve, I will work hard to stay engaged, listen carefully, and represent the profession with honesty, professionalism, and real-world experience. My hope is that pharmacy in Texas becomes more proactive, more unified, and more sustainable for future generations. I would truly appreciate your support and your vote.
For Speaker-elect of the House of Delegates, Chris Hobart.
Hello, pharmacy friends. My name is Chris Hobart. I'm a pharmacist and pharmacy owner, and I am honored to be running for the position of Speaker of the House of Delegates for the Texas Pharmacy Association. Now, when I joined this profession as a pharmacy technician, pharmacists were America's most trusted profession, and unfortunately, we have fallen from that spot. And if we ever want to get to the top again, we cannot phone it in. We need more Texas pharmacies present in our communities, fighting for our patients against corporate interests, and more engagement with our state and national pharmacy associations. I am running for this position simply for the opportunity to fight for the best interests of anyone who works in a pharmacy. A little bit about me. I am currently serving on the Texas Pharmacy Association Board of Directors. I have served as an executive board member of the Pharmacists for United for Truth and Transparency for the past 2 years. Also the Texas Legislative Vice Chair. We recently had Mark Cuban on our podcast to talk about pharmacy. I have traveled to Washington, D.C. 4 times in the past 2 years to advocate for the profession. I have spoken personally with legislators nationally, locally. I've had legislators in the pharmacy. I've submitted over a dozen complaints to the Texas Department of Insurance, and I've gotten patients and other pharmacy professionals involved in advocating for the profession. One of my favorite projects is right here over my shoulder. This was done with me and a student I was precepting, and he got 100 on this for sure. We went to 20 pharmacies around West Texas, got prescription labels from them, talked to them about what's going on, what the real issues were that they were facing, and really pushed for them to get behind the Texas Pharmacy Association bills that we were pushing. And we brought these homemade posters to the Capitol. They were a big hit with the legislators, with other pharmacists. Just nice to see other people, seeing everyone involved. And if we did this with just 20 pharmacies, as Speaker of the House of Delegates, we could do this with 1,000 pharmacies. We could get more and more people involved, riled up, passionate about the profession, ready to move it forward. And that's exactly what I would love to do with this position. We are only going to move this profession forward together. We need everyone to get involved. I love pharmacy. I love seeing others like y'all getting excited for the profession, getting riled up, and moving it forward. If we haven't met yet, I hope that I can meet you at the Texas Pharmacy Association Conference in July. And if we have met, I really hope I get to see you again. Let's move pharmacy forward together. Thanks.
For Speaker-elect of the House of Delegates, Scott Kendall.
Hi everyone, my name is Scott Kendall and I'm running for Speaker-elect. With over 20 years of leadership experience, I've learned that effective leadership comes down to accountability and action. As Speaker-elect, my goal is to make every meeting more impactful than the last. That means clear agendas, focused discussions, and real follow-through. I'm committed to using our time together to strengthen TPA, maintain momentum on PBM reform, and advance service-based billing. I appreciate your support and your vote. Let's make this term more productive than last. Thank you.
To learn more about these candidates, please visit texaspharmacy.org/candidates.